Lateral Medical is an ISO accredited company that works closely with the anaesthesia nursing community to develop and distribute innovative and sustainable solutions in the areas of anaesthesia, critical airway management and patient warming. In conjunction with our sister company, Genesis Airway Innovations, we have developed a portfolio that includes local and international innovations designed to bridge gaps in critical care, improve the user experience and ultimately patient outcomes. A national team of dedicated product specialists and clinical educators are readily available to provide support, education and tailored service to meet the specific multidisciplinary needs of the anaesthesia and critical care nursing community throughout Australia and New Zealand. The following product introductions will offer an insight into a variety of just some of these innovative and sustainable solutions.
In the instance that endotracheal intubation becomes necessary, we can utilize this technique to secure an airway prior to the removal of an LMA. To begin, we connect the endotracheal tube to the reinforced tubing extension. We then attach a self-sealing connector with a sidearm, and ideally, we would then advance a fibre optic bronchoscope through the tubing. However, in this video, we will demonstrate using a bougie. We advance the bougie, being careful that the intertube connector does not come apart, and we will take it towards the tip of the endotracheal tube. The anaesthetic circuit is then removed from the LMA, and the tubing set is advanced through the air passage. Once the vocal cords are visualized through the bronchoscope, it can then be advanced through the cords, and the tubing is then railroaded over the bronchoscope, and the cuff is inflated. The airway has now been secured with an ETT, and the patient can now be ventilated. The fibre optic bronchoscope can then be removed, and holding the tube steady, the laryngeal mask can also be railroaded over the tubing until it is no longer in the mouth. The connector between the ETT and the airway tubing can be detached, and the spare 15mm connector can be used to ventilate the patient. The airway tubing extension is removed from the top of the LMA. We have now converted from an LMA to an ETT with limited interruption to ventilation using the Genesis Rescue endotracheal tube.
AMS is a small UK-based business specialising in the design of world-leading connector systems aimed at optimising the safe delivery of pumped drug infusions to patients. For many years, doctors and nurses have known that using the wrong type of connector can risk harming a patient. AMS is the culmination of clinicians working with manufacturing and technical experts to produce what are widely held to be the safest drug connector systems available in healthcare.
So anaesthetic medical systems was developed because doctors wanted to see much greater patient safety in the way that we connected pumped drug infusions to patients.